Hello, welcome to Local Edition. I'm Leslie Leyton. Well, the House has passed President Trump's promise to repeal and replace Obamacare. So where do we go from here? Alan Lowenthal, congressman who voted along with the rest of Congress, here now to discuss his thoughts on that. Welcome.
Yes, I voted no on the repeal and the replacement. Not that the Affordable Care Act does not need some improvement. It does. Whenever you have such a complex piece of legislation like that, any social program, when we first did Social Security, when we did Medicare, through numbers of iterations, that has not happened, whether it was because of the way it was first formed and the kind of contentiousness and polarization, or what has happened in terms of how the nation's become more polarized. There was no doubt that the debate that we had yesterday first was done in a way that really did not really look at the critical issues. It was one side wanted to repeal it. They didn't care what was in that bill. They just needed to get the votes. And it was done in what I considered a very reckless way, in that there were no hearings. We had no congressional budget office to say what it was, what it would cost, what impacts it would have, who would lose insurance. Remember, we're talking about the sixth largest contributor to the U.S. economy. It makes up almost 20% of the U.S. economy is healthcare. It is the economic impacts of changing the healthcare system are tremendous, and the hospitals throughout the nation, especially rural hospitals and all the medical groups, were very worried that that lots of issues were not. That bill that we were replacing it would definitely economically do devastating damage to them, because for the first time they were now getting paid because of having such a larger number of people who had health insurance who were not using the emergency rooms just for public service and not getting paid. Now those folks were walking in with having health insurance. We had dropped the health insurance, then the lack of people who did not have insurance from 20% in the nation to less than 10%. So it hadn't solved everything, but we had done a significant amount. Without really bringing the input of the healthcare industry, because of a campaign promise, the House voted to, I think, without any information, without any input from the industry, to end it. I don't think that's, I think that it's a temporary victory, but the real work will get done in the Senate. The Senate will deal with lots of these issues.
Do you think in some ways this is somewhat of a first draft, that things are going to have to change as it is presented to the Senate? And
there are a number of things that the Senate has to deal with. Number one, you can't take away 24 million people's worth of insurance. You can't just get rid of the Medicaid expansion. They know that. So that's the first thing. However that's done, you just don't do that in America. You just don't tell people they can't have. Second one is they know that they have to come to grips with the issue that people who have pre-existing conditions cannot be put into a class where their health insurance will fluctuate depending upon the other people in that class. They're going to be put in high-risk pools. While theoretically that could work by doing that, it takes, all the healthcare experts say, it takes a vast amount of subsidizing those pools, not much more than the $8 billion.
But aren't the majority of the people signed up under the Obamacare, they are subsidized, even their premiums?
They're subsidized. That's the difference.
And if you
they're subsidized, they're subsidized in terms of their premiums and their out-of-pocket costs. And that's the Medicaid expansion primarily.
So there's an element of how much money and where is it going to be spent at which point?
Well, who pays for it? And what it is that had been paid for by a tax on the wealthiest people in America, and that has been shifted back. They've gotten a tax break, and so we are shifting the emphasis back to those people who have the least amount of money. And therefore, that's why the CBO said they're not buying health insurance anymore. That's it.
Well, let's approach it from this angle. If we can't really know what's in Obamacare unless we experience it for 10 years.
Right.
We can't really know what is in President Trump's plan unless we really get going on it.
But the president also said, I've seen people dying in the street. Everybody needs to have health care. I don't care what model we do. You can't take away health insurance for 24 million Americans. That is,
It's hard to
can't
take
tell hospitals.
anything away from anybody.
Especially health care. We're talking about health care.
But is it insurance if you take the risk element out of the equation? Is it still insurance, and can you still care
insurance companies,
for people who are low on their money?
That was why the insurance companies said it had to be a mandate if we're going to provide that. You have to have everybody a player. And the biggest problem then is, how do you get everybody in? We have gotten many of the low-income people into it. But the problem that we still have to deal with, if we have the Affordable Care Act, is how do you get the millennials into it who believe that they're invincible?
Okay, so that's a great point. If we continue forward with the Affordable Care Act, what changes? What needs to be addressed that it is more effective and so that the costs don't get
Well, you have to
completely
look
out
at
of
where we've
control?
had successes. The Affordable Care Act was designed by the federal government to be state-run in state kind of exchanges, letting the state get the money and then seek out insurance companies that had to follow these federal rules that were set up. Only 13 states elected to do that. 37 or 38, counting the territories, decided not to get involved at all in healthcare and put it on the federal exchange. The ones that were on the federal exchange did not work very well because California worked quite well. Didn't keep all the premiums as low as we'd like, but that's another issue we have. But it got people involved on it. And the reason why is imagine if you're an apartment building manager and you're in downtown Santa Ana or in Long Beach. You can tell which buildings have managers in them by the care. Those can be right next door. The building that doesn't have management, property management, right there, watching out, making sure things go right, is in worse shape than those.
So maybe there's an
and
element
that's what
of
happened.
quality of care.
That's what happened in California. Covered California did a phenomenal outreach program. They got people in. They got the hospitals involved. They got all the doctors involved. That's why you're not hearing an outpouring of people in California wanting to get rid of it.
But what about those same buildings that are being maintained by someone who owns the building and has an interest in it, and someone who's expecting someone else to maintain that building for them?
I agree that there are different models, and you can put the risk back into. But I think there just have to be basic principles that we all agree upon. Number one, it has to be affordable, and so we have to see, how you make it. Number two, you can't provide a system that reaches less people than what we have. You don't want a nation that has over 20 million people, 20% of the population having no health insurance and using our public facilities and having really health problems. That's the second part. And the third one is you have to have one in which the industry and people themselves help to define and to decide and to work on. And so we replaced a program that wasn't perfect with one that was completely untested and really questioned by the health insurance industry. No one and they're not Democrats, the health insurance. They are very concerned that if this goes through, this will not be, it's not that they're against, it's just not workable.
Congressman Alan Lowenthal, thank you for being
Thank
here
you.
today. Glad you could join us. Glad you could join us as well. I'm Leslie Leyton.